Hey everybody, Dr. Dane here, and I am super excited about what I learned this past weekend in Houston, Texas. We were at a seminar called Vital Health Protocols, and the information that I learned is just too good not to share. I really want our patients to understand the value of doing more in-depth lab analysis and blood analysis, because there's so much today about lifestyles that I think are creating disease and dysfunction in people's blood that they don't know about. So for example, one of the things that we learned is, did you know that the majority of people that have a heart attack have normal cholesterol? And so we're taking statins for our cholesterol, but it's really the quality of our cholesterol. We can have high HDL cholesterol, the good cholesterol, but it's bad cholesterol, it's bad quality cholesterol. We can even have lower LDL cholesterol, but the cholesterol, LDL cholesterol, is not small, dense LDL particles, and so you're less at risk. We learned about inflammatory markers. We learned about vitamin D3. We learned about genetic variants. So for example, you can have a genetic variant that you've gotten from your mom and dad that makes you more prone or more susceptible to carbohydrates or protein. So you could be a carb type where you're okay eating a higher amount of carbs versus somebody who's more of a protein type who's going to be more at risk for type 2 diabetes eating carbohydrates. So do you know what type you are? Are you a carb type? Are you a protein type? We learned about other things like apolipoproteins, and I know these are big words, but you need to know, do you have sticky cholesterol? Is that cholesterol causing problems like arteriosclerosis? And these are markers that you need to know. I look at it like a crystal ball. The nice thing about the Boston Heart Labs is they give you a patient report. And my wife and I have both had this laboratory in-depth analysis done on us, and we've made some changes in the way we eat and the way we supplement based on some of the things that we found out in our labs, and we consider ourselves pretty healthy people. So I'm going to highly encourage you, if you're a patient wellness solutions center, that you talk to one of the doctors about having your Boston Heart Lab profile done. It's not the lab profile that you have done at your annual physical checkup with your medical doctor. It's very different because it's much more in depth. It's functional. We're not looking for pathology. We're not looking to diagnose disease. We're looking at, is your labs, is your blood creating a functional problem that may lead to a disease like type 2 diabetes, like cancer, like heart disease. And remember the law of cause and effect. For every action, there's an equal and opposite reaction. These lab markers are reactions, but the reflection of your underlying lifestyle. So if we see your labs, we can make these course corrections to make sure that you're not heading down the path towards dysfunction, disease, and early death. So this is Dr. Dane. I hope you get in. I hope you get your Boston Heart Labs done. Talk to one of the doctors about it and learn about these amazing biomarkers that really predict your future.